So Deep Plane Facelift is having a moment, well, really more than a moment. It's been years that people have been talking about this procedure. Again, nothing new under the sun. Plastic surgery, this plastic surgery procedure has existed for a long time and was popularized way back in the early 90s. So Deep Plane's been around for a while, but really has caught fire in the past probably 5 years or so. What is the Deep Plane? Well, there's a couple layers to the facial skin and to the neck skin. So we have the skin, and then underlying that is something called the SMAS. The SMAS is an acronym. It's superficial musculo-aponeurotic system. So a long term, but it's basically a fibrofatty layer that contains the platysma muscle in the neck and some muscle fibers that extend all the way up to your zygomatic arch. And it's one continuous sheet that goes from here down all the way into the neck. Well, when there's looseness or laxity of that structure, we want to tighten it because the SMAS carries with it the jowl fat, the buccal fat, some of the other facial fat pads like the malar fat pad. When we pull the SMAS, we pull those facial fat pads back into position and tighten up the platysma muscle or bands in the neck. You can tighten it multiple ways, right? So a deep plane is actually where we cut or incise that muscle here and then separate it from the underlying ligaments and structures and get more lift or pull on the muscle than if we were to just elevate the skin and suture it. That's called imbrication or plication of the SMAS. So Deep Plane actually separates that muscle from the underlying deep structures, separates it from the ligaments which are holding it back from being lifted as much as it maximally possibly could, and then carrying the excess skin with it. Why is it known as a more natural looking facelift? Well, it's more natural because you're actually putting the tension on the underlying structure that's loose, which is the SMAS and the platysma muscle, than you are on the skin. No more windswept or pulled look. You get a soft, natural, long-lasting, very durable lift that is great for most patients. So I do Deep Plane, I do SMAS imbrication, I do SMAS plication in varying patients according to the patient. Whatever the patient needs is dictated by the anatomy. And so that's why you come to a facial specialist, somebody who will tell you exactly what procedure will work the best for you. In some cases, Deep Plane is the answer. In other cases, another kind of lift, a mini lift or et cetera, is the answer for you. And it really depends on your facial anatomy. And that's a much more complicated in-person discussion that you'll do here in the office.